and welcome to Health Exposures. I am Deborah Arneson, your host for the evening, and again we have a wonderful guest. If any of you watched the show last week, you're familiar with Aaron Bartz, and Aaron is a representative with Orthomolecular Products. Some of the vitamin companies that I work with are the finest as far as I'm concerned, and his company is one of the top. So Aaron is a walking world book of knowledge, and tonight he's going to share with us information on B.P.H, which is...
B.P.H is benign prostatic hyperplasia.
Say that fast 10 times. So this is all about the prostate. So for those of you who have loved ones who have prostate concerns, and for those of you who have prostate concerns yourself, tune into the show because it's going to be loaded with information for you. We're going to help you kind of make your way through the muck and the mire, figure out what is right for you, what can help with inflammation, and basically explain to you what benign prostate hypertrophy is.
Right.
Okay. So what is it?
Basically, it's an age-related, non-malignant enlargement of the prostate gland. It's not cancerous. It's not prostate cancer, but it's just an enlargement of the prostate gland.
What causes this? An enlargement of the prostate?
Well, there's a couple factors that play a role in it. One is hormonal, involving things like testosterone and estrogen. The other aspect is inflammation, which can be caused by bacterial infections and other things.
Really?
So that's basically what leads to benign prostatic hyperplasia.
And the primary symptoms when you have B.P.H would be what?
Would be frequent urination, particularly at night.
Can women get this? No, I'm kidding.
No, they cannot.
One thing we don't have to worry about, girls.
They would have hesitancy or intermittency, decreased caliber or force of the urination, right? Other symptoms would be the chronic urinary tract infections or bacterial infections. Because of the residual urinary volume, they're not able to let it all out, so there becomes bacteria in the urine and they get bladder infections.
So if you can for us, Aaron, give us a quick kind of anatomy, physiology on how all this works together, the prostate with the bladder, with the kidneys, with the urethra.
Okay. Basically, there's two, like I mentioned, there's two hormones that are involved in this, testosterone and estrogen. And actually in men of this age, testosterone levels are actually decreasing.
Is that an indicator that the problem could arise?
No, it's just a normal cause of normal
age-related
process. Estrogen is actually increasing. The problem becomes when testosterone gets converted to something called dihydrotestosterone. When that conversion happens, dihydrotestosterone binds very strong to what's called the androgen receptor, and this stimulates growth factors. And these growth factors lead to the hyperplasia, or the increase in number of prostate cells, which causes the symptoms that we talked about, the frequent urination, that type of thing. So that's one of the problems when testosterone converts to dihydrotestosterone.
Why does it do that? What perpetuates that?
There's an enzyme called 5-alpha reductase that converts that, and sometimes it's diet-related. There's other factors.
Meaning that what could you be doing wrong with your diet?
Well, not enough protein. Lack of protein.
Which is really common in Americans, folks. A lot of people are very protein deficient these days without knowing why or how. So
that's one of the dietary reasons that could lead to that.
What's another dietary reason?
That's the primary one.
Mineral deficiencies?
It could be, but I haven't seen much research on it. The primary dietary reason is the protein. The other area is the estrogen, and the estrogen is actually increasing in elderly men, and that increase, even a minute increase in estrogen, can cause the hyperplasia, or the increase in number of cells in the prostate. And so those are the two issues hormonally that you want to address. Inflammatory, basically, the bacterial infection is what's causing the inflammation, and you can address that through antibiotics, or you can address that through nutrients.
The question I have for you then is, when the prostate swells or the cells enlarge, that puts pressure on the bladder.
Right.
And the bladder then can't actually
and it cannot
release all of the urine, and the urine ends up kind of backing up in the bladder, and it causes like a bacterial overgrowth because you must clear out all that urine.
That's right.
And when that happens, it almost flows back into the prostate? Yeah,
and actually you could end up with blood in the urine, which could indicate more problems. And that's what's happening, is the urine is not being fully released. When they go to the bathroom, they don't feel like they completely release everything, and that's why they keep going back and back.
Well, it's growing, B.P.H, isn't it, in this country? It's becoming more and more common?
Yeah, it's In the fourth decade of men's life, it's about 10%, so wouldn't be very statistically worrisome. But by the time men hit age 50 in this country, it's 50% of the male population over the age of 50.
Have B.P.H.
Right, and once they're in their 70s and 80s, it's 90%. So it's very common. At those, you live long enough, basically, there's a high percentage that you will get it. It's not necessarily worrisome. It's more, what do you want to say, uncomfortable or inconvenient. If they have to continually run to the bathroom, if they can't get good quality sleep because they're continually having to get up, or the bacterial infections would be probably the most worrisome portion of it. They would want to take care of that.
Well, I'm sitting here thinking while you're speaking about estrogen promoters. And when you think about it, and you realize that many of the compounds that we're spraying and using on our insecticides and sprays, which are so prevalent in our food chain, they're on our fruits and our vegetables and our grains and our wheat products, actually are what we call estrogen mimickers.
Yeah.
So I would think, since this is on the rise, and by the age of 50% of men have a problem with this, that you have to look at the sources of estrogen promoting in the body.
Sure.
Since estrogen naturally goes up in men over the age of 50, testosterone goes down, and what promotes estrogen? Again, a lot of our meat products are loaded with hormones, and estrogen again. So probably eating organic meats would be beneficial.
Yes.
For men.
And getting more protein in the diet.
More protein. So here, you know what we're going to do? We're going to give them a sidebar on how much protein they need.
Okay.
Take your own body weight. Okay, get a little pencil and paper out. Take your own body weight, divide it by 2. That will give you the grams of protein that you need per day to support your system. Now, it's going to come up to be a large number of grams. Divide that number of grams by 7, because there's 7 grams in 1 ounce of protein, to find out the number of ounces that you need approximately per day. You may find, based on your weight, that you need 14 ounces a day. Now, you don't have to sit down and eat 14 ounces of beef. That's not what I'm saying. But you should count your grams of protein and realize that in a half a cup of grain or rice, you get about 3 grams, half a cup of vegetables, you get 2. So try to get up to at least that 100, whatever it is, of grams of protein per day. So that's helpful. If you can do it from non-estrogen sources,
be better.
Like non-pesticide-based foods, that would be beneficial too. Okay, so tell me, what causes B.P.H? Again, is it too much estrogen in the body? Is it, again, the bacterial infection? People who aren't releasing urine in the bladder?
Yeah, all those things contribute to it.
An age relationship is really primary.
Right.
So you guys have like a lot of fun to look forward to.
Right.
What's the standard operating procedure medically for B.P.H, or the enlarged prostate?
There's 2 routes. One would be surgery, where they actually remove a portion of
They laser it?
Yeah, where they remove a portion of the prostate gland. Yeah, it doesn't sound too inviting.
No.
And actually, this will take care of many of the symptoms of B.P.H.
Okay.
The drawback to it, besides having to go through the surgery, is that there's many side effects, such as sexual dysfunction, impotence.
Once you've lasered it?
Right, erectile dysfunction, that type of thing.
I bet.
And
it's traumatized.
Right, and so that's a reason why many men would not want to go through that. The other area that's done more often is the drugs. And some of the drugs, they're either 5-alpha reductase inhibitors, which we talked about testosterone being converted to dihydrotestosterone. Right, the 5-alpha reductase is the enzyme that converts testosterone to dihydrotestosterone. So there are 5-alpha reductase inhibiting drugs, or there's
such as what?
Proscar.
Okay.
Or what's commonly referred to as finasteride. And that's probably the most common one given to men with this problem.
What are the side effects from these drugs?
Kind of similar to the surgery. You get the sexual dysfunction, impotence, that type of thing. And actually, another drawback to it is that you're on it for 6 to 12 months before you know if it's even working. It takes a long time to work. A lot of them don't see any benefit from it until they've been on it for 6 or 12 months.
So
and they get all
that
these
may
side
not be the
effects.
problem. Can they actually test for elevated what is it, dihydroxytestosterone?
Oh, the dihydrotestosterone? I do believe they can test for that. I don't know why it's taking so long for it to work. The percentages on it are very low too. The effectiveness of Proscar, and this is just from talking to different urologists that I've met with, a lot of them tell me it's no more than 30% effective. So they're giving it out.
30%.
Yeah, it's pretty low, and they're
Is it an
giving.
expensive drug as well?
I'm not sure on the cost of it, but
Hope never to know.
yeah,
Okay.
but it's given out pretty commonly, and it's just not that effective. And actually, there's herbal components that are as effective or more effective that don't have the side effects associated with Proscar.
Well, sure.
So
Well, again, just for our viewing audience's edification and clarification, there are always side effects and there are contraindications for every drug, especially if it's used long term. So the important thing to remember is that all medications, whatever they are and however beneficial they appear to be for the short haul, will in fact take and kind of pillage out of the body many different vitamins and minerals, especially our water-soluble vitamins, the B complexes, which are necessary for every biological function, and all of our minerals.
yeah, that's one interesting thing that brings to mind is in the April 15th issue of JAMA, Journal of American Medical Association this year, there was an article on the leading causes of death. The fourth leading cause of death was due to drugs. Drugs that were given out that caused death. And these were not, what was not included in that number were drugs that were accidentally overdosed or misprescribed. I mean, these were drugs that were given for the appropriate
Specific
condition,
reasons.
were dosed properly, and ended up in death.
What percentage died from appropriately related drugs?
That was all of them. They didn't, in that number, it was the fourth leading cause of death, and it did not include any of the drugs that were overdosed or given for the wrong reasons or whatever. It was only those that were prescribed correctly, right dosage, and it still ended up in death. So it's the fourth leading cause behind cancer, heart disease.
Taking prescription drugs that are appropriately designated for the problem
Yeah.
is the fourth leading cause of death.
Right.
Well, there's a good reason not to get back to the doctor really soon and to explore some other
Some natural,
possibilities and options for nutritional healing. So what types of nutrients or herbs, et cetera, would help people with, enlarged prostate problems?
The most common is saw palmetto, and that's probably a majority of your watching public would probably have heard the name.
Right.
And saw palmetto, what it does is it blocks that 5-alpha reductase enzyme that converts testosterone to dihydrotestosterone. The benefit of using saw palmetto over Proscar or finasteride is that you don't get the side effects. In studies done in Europe, it was shown side by side that saw palmetto had 1/6 of the side effects of the Proscar, and the only side effect was some mild gastric irritation, which if they took it with some food, a lot of times that went away.
Goes away.
Right.
How much saw palmetto would be necessary? Because I'm sure many people out there have tried it. And they've tried it unto itself and perhaps haven't gotten the results that they anticipated, relief of discomfort, pain, pressure.
What they want, and this is based on the research, is they want about 160 milligrams, but it must be a standardized saw palmetto, and it needs to be standardized for 85 to 95%
Tell people
fatty acids.
what that means, standardized. This is good information.
Yeah, with your herbs, depending on where they were grown, how they were harvested, how much rainfall they had, how long they sat in the field, and herbs' potency can vary greatly. And depending on all those factors, you may have a herb that's very potent or you may have an herb that's very weak. And so you need to standardize for the active constituent so that you're making sure that you're getting a standard dosage, appropriate dosage. Otherwise, it might be very weak one time, might be very strong the next time.
So the efficacy would either be enhanced or decreased.
Right, right. And the effectiveness thereof, too.
So they have to measure for that.
Right. Right,
Okay.
and that's what when we're talking saw palmetto, we're standardizing for a fatty acid content. Now, if you're talking another herb, you may be standardizing for whatever its active constituent is. But
So will it say that on a label, standardized?
It should.
Okay.
If it doesn't, I would look somewhere else for something.
Don't buy that
right.
product.
Just because you don't really know what you're getting. It's important to know that it's standardized. I know with some of the herbs for inflammation, I deal with a lot of chiropractors, and sometimes they'll use an herb called turmeric. And turmeric is standardized for curcumin content. That's the flavonoid that contains the lion's share of the pharmacological activity of turmeric, why it works for inflammation. And if it's not standardized, on average, now, here's an interesting point. With turmeric, we standardize it for 95% curcumin. That's the active constituent.
That makes it work.
Right, and unstandardized turmeric it's gonna contain some curcumin. You just don't know where. The average amount that an unstandardized turmeric contains is about 3%. So you're talking about 3% versus 95%. It's a huge difference.
Which makes it really important to know for the consumer that they need to buy really highly active, standardized, biologically available products.
Right.
And those aren't generally sold over the counter as much as you think they are.
Right.
There are just very few companies that have that high of a quality control factor.
It costs more to do it. It costs more to
Ensure
get it right, ensure a standardized material. And I'll tell you, when you talk about the turmeric for the inflammation, the different chiropractors that use it, that have used an unstandardized turmeric and now use a standardized turmeric, tell me that the difference is night and day.
Well, I've started using your product for people with inflammation and sinus problems and just, constant, like all types of problems. The QR1 product, amazing stuff.
Yeah, it's
great results. The MSM, same thing. Great results. People are seeing lowered inflammation, and I mean, I'm using the turmeric on people who have, yeast problems even, and lots of die-off problems from parasites and whatnot, and they're doing very, very well with it.
So many people are trying to do the right thing as far as their health and doing vitamins and spending valuable dollars. And it's important to know what you're buying for the dollars that you're putting out there.
Right.
And that's what we try to do, is to make sure that the product is a high-quality product.
Well, it's funny because I had one of my clients call today, and she said, "What do you know about this particular company?" I won't name names, but it's another network marketing company. And I was like, you know what? I mean, basically, they're out to make money, so I won't even look at them. I really only deal with pharmaceutical grade products that are really bioavailable, and it's important for the consumer to know that you can spend a fortune on some of these network marketing products, and they're not always very bioavailable.
A lot of those products are even more expensive than the pharmaceutical grade products because they have a lot of the profit built into them.
The hierarchy has to be paid.
Right. If you're building an upline and you're paying everybody on the way down, that money comes from somewhere, and usually comes from the people buying the products.
So I know that, and this is just a sidebar, Aaron, but people, I mean, as a consultant, I can send products off to have them tested. What can the consumer do to find out whether or not what they're really paying for actually contains what they think they're buying?
Yeah, it's a
tough question.
That's a tough question. I mean, I guess you have to deal with people that you trust. If you're going to a physician, a lot of the physicians I deal with spend their valuable time becoming educated on different nutritional modalities and that type of thing. And I would go to somebody that you really trust their reputation and trust that they're researching it.
That's good advice. Okay, well, we sidebarred a little bit. So what other nutritional products do you suggest for enlarged prostate?
Some other herbs would be one called nettles root extract, and the reason that would be beneficial is you got a lot of people that are taking just saw palmetto, and it's probably effective 60% of the cases, but why isn't it effective for the other 40%? Well, one of the areas could be saw palmetto doesn't really address the estrogen issue, and it could be more the estrogen, that increase in estrogen, that's causing the problem. And an herb that addresses that issue is called nettles root extract. Nettles root blocks the binding of estrogen to the prostate cell. And
does it block it anywhere else?
No, it seems to be prostate specific.
Interesting.
And actually, that brings out something else too, is that the prostate gland seems to be more sensitive to some of these hormonal changes in men than other areas of the body. It seems the prostate gland, for whatever reason, seems to just be more sensitive to the decrease in testosterone, the increase in estrogen.
Because it thrives on testosterone, right?
Right.
I mean, for years, people were under the assumption that it was a zinc deficiency, which does play a role.
Zinc does play a role, right.
But it could be more than just that. So again, I think it was the last 4 or 5 years they came up with the estrogen, part of the equation, that the increase in estrogen really created more of the problem.
Yeah, the zinc, I would recommend taking that. You want to find a formula that maybe combines these things, the saw palmetto, the nettles root, some zinc. And if you're going to be taking zinc, I would recommend a little bit of copper. Not a lot. We don't recommend copper in the high amounts, but maybe 1 or 2 milligrams of copper, because when you give zinc by itself, it can create a copper deficiency. So you'd want a product that has both those ingredients in it.
Well, do you offer one?
Yeah, the product we make is called Prostatic Forte, and it combines the saw palmetto with the nettles root, the zinc, and the copper. And it also has one other herb called pygeum. And pygeum, most of the studies on pygeum have been done in France, and pygeum helps with the inflammation, which is the other aspect that we were talking about as far as there's
So
the
you've got
hormonal-
all the factors
Right,
covered in this
right,
one product.
Right.
Is it outrageously expensive?
No, it's if you took the standard dosage of it, it'd be less than $1 a day.
That's great. And what is the standard dosage for most
Just
men?
2 capsules per day. They do one in the morning, one in the evening.
Can you take too much?
There's not really any toxicity. Like when you talk saw palmetto, there's not really any toxicity factors, but there's no reason to go higher than that. There's no increased benefit. We would just recommend staying at the
standard
dose. Right.
Just a sidebar again, how did Orthomolecular come to be? Because you're a pretty exceptional company in many ways.
Orthomolecular was founded by a gentleman that had repped for a number of other companies in the industry, and was really basically into educational aspects of nutrition and that type of thing. And he saw what he would go out and detail a physician and talked with a physician about nutrition and why they should use supplements in their practice. He saw that sometimes what the manufacturing end wasn't matching up with what he was talking about, and to him that was a conflict of interest, and he really wanted to start a company that would do in their manufacturing end of what they were doing,
products.
right, would match what they were going out and telling the doctors, because a lot of times that it falls down in that aspect, and that's what we strive to do more than, we don't even do a lot of marketing and that type of thing. What we do is more the manufacturing end of it and making sure that hits the standard.
And education.
Right, right.
So that's great. So how long ago was this company formed?
About 9 years ago.
That's great.
So.
Is he a biochemist?
No, he just grew up in the business.
In the industry.
Ever since he was a young 12 years old. Yeah, his uncle owned a vitamin company and
who is
kind
he?
of grew up there. His name's Gary Powers.
Gary Powers,
Yeah.
okay. Out of Wisconsin.
Yep.
We love those northern boys and girls. Okay. Tell me this, how do saw palmetto and nettles root compare to common B.P.H medications?
They are as effective, if not more effective, percentage-wise.
Over the long haul or in a
right.
shorter period of time?
No, well, they will work, like we talked about Proscar. That takes 6 months to a year, sometimes to know if there's any
and
benefit.
bring down, okay.
Right, to even know if you're moving in the right direction.
Proscar is the drug.
Right.
That's commonly prescribed.
The nutrients, the saw palmetto and the nettles root, usually you will see results within 45 to 90 days.
That's fast.
And yeah, it's very quick, and the percentages are better than what you see with the drug. And this is really an area in nutritional medicine. We talk about a lot of different areas where nutrition can be beneficial over the drugs, but this is one area where nutrition really shines because the studies are there. It's more effective than the drug. There's less side effects. I really cannot see a reason why somebody wouldn't try this. Yeah. I mean, I think a lot of the physicians that just go and do the standard traditional route, it's just because they haven't been educated on it or they haven't taken the time to look at it, because if you really looked into the studies, I can't see a reason why somebody would not
They stay
try
where
this.
they're comfortable and familiar. So it's important, again, for the individual, for the patient to go to the doctor and say, hey, I've got a
Take a look
product
at
I'd
this.
like you to look at, and here's some data and information and research. And
I actually, by doing that, if enough people do that, you will get the doctor to start to ask questions, because this is an example I had. I had a urologist that a number of his patients had come to him saying, what about saw palmetto? What about saw palmetto? I'm taking this Proscar, and got all these side effects. And he had been asked it so many times that he finally, one of his friends was a pharmacist, and the pharmacist said, I know a company, it was our company that makes a product, you should investigate it. So he called me up and he said, come down to my office, talk to me about this. I got a lot of patients asking me about this, and I don't know anything about it. So I went down there and we went through the research on it and showed him how it worked. And
he's a convert.
Yeah, he said, this is really, I mean, I can see how it works. It works, real similar to Proscar, but it doesn't have these side effects. And he started using it, and now he swears by it. But
He's there, I see your convert.
but it came from a patient, a number of patients saying, "What about this? I've read a little bit about this. I'm not sure." They still wanted his approval.
Sure.
They weren't just trying to do their own thing, but they respected his opinion. But they said, "What about it? Check it out." And you did.
Well, see, that really comes back to, again, taking a proactive approach to your healing process as well, and asking the doctor for alternatives. I mean, I can't tell you, I probably get 5 to 10 calls a day of people asking for information, and I hope to be always a resource, of information for people who have questions. So I love the handouts that you give to me and other companies give to me that basically educate, both the physician and the patient. So there's no shortcut to healing yourself. You need to know, and you need to be resourceful, and you need to investigate. So
That's right.
again, that's one of the things that your company does. Now let me ask you this. How long should people who have an enlarged prostate continue on the product that you mentioned?
Once they see results, say they used our particular product and they did 2 capsules per day.
The name again?
Prostatrol Forte.
Prostatrol
So
Forte.
if they did that for the 45, 90 days, they're seeing significant results, then they can reduce the dosage. We would say cut it down into maybe just 1 per day. And if the results, if they're still doing fine, try 1 every other day. Our idea with supplementation is to give the body what it needs, and then not to force the issue, just taper back off on it and find where you can find out what, at the lowest dose, what you can do to keep the benefit. And so that's what we would do with this one, is just taper it back and find out what they need to maintain in order to...
That's simple enough.
Right.
1 to 2 a day is really nothing.
Yeah, it's very convenient and not too
simple
costly.
and healthful. So what other things can you suggest to our viewing audience that they might do from a nutritional vantage point to reduce B.P.H, or benign prostate hyperplasia?
I would, going back to the diet, getting more protein in the diet, doing the supplementation. There could be some kind of on this, along the same topic, there could be some questions about impotence. That
My next question.
Okay. There's some other herbs that would benefit somebody with impotence. Those herbs would be things like ginkgo, which a lot of people have heard about ginkgo for mental function.
Good for your brain.
Right. And it improves circulation or blood flow, which would be beneficial for somebody with impotence. There's also an herb called Mirapuama. And
I've not heard of that.
Yeah, that's a very obscure herb. It's not very common. But Mirapuama, there was a study done in 1989 in Paris, France, at the Institute of Sexology. And it was done on 262 men that complained of decreased libido or inability to maintain erection. And within 2 weeks of just supplementing Mirapuama at about 1,500 milligrams a day, 62% of the group claimed it had a dynamic effect as far as erectile function.
And you can actually provide that to nutrition consultants as well, so people know where they can get these products.
That's right. That product's called Androplex.
Androplex.
It's got the Mirapuama, the ginkgo, and then a ginseng in it.
Great. We've got to wrap it up here. And again, thank you for your time. This is very interesting. And folks, we have all kinds of seminars at Nutrition Consultants to help endorse your educational aspect of healing. So, give us a call. We've got one July 11th, August 26th, October 10th. All on thermogenesis, ABCs of nutrition, menopause, factors like that. So please, until then, take very good of your health, good care of your health, I'm sorry. And have a good evening. And Aaron, thanks again for being with us. It was really wonderful having you.